Serve a bang bang.
I'm going to use that now, Joe.
So there we go. We've just tweaked your future bio for any more podcasts and radio interviews you do.
Yes, we're going to have to top that.
And you've set the bar high, guys.
Yes.
So Asha, how did you come to make your primal shift?
It was a long journey for me, probably over 10 years at least. I always say to my clients that experience is the best teacher, and boy, do I have a lot of experience in doing the wrong things. So I was in my early 20s. So I'd never had any issues with my skin whatsoever, luckily. And around my early 20s, I start to break out. And I was really sort of unfamiliar with what to do about that. None of my friends had breakouts. I didn't really feel like I had anyone to talk to. So I went to my doctor and he recommended that I go on the pill. And I thought, well, that seems quite easy. All of my friends are on the pill. That doesn't seem like it's going to be doing any damage. And so that's what I did. Not really knowing what I was getting myself into, I suppose. And look, for a while, that worked really well for me. And I was quite happy with that. I was still having the occasional breakout. But I guess I had a perfect storm brewing at a metabolic level that I was just suppressing, and I just really had no idea. And so in my mid-20s, I had a few things happen, a few stressful events. I went through a relationship breakdown, and I was studying my naturopathy. And I thought, I don't want to be taking this medication anymore. So what a great time to just, come off the pill, one of the most stressful times of my life. And I ended up having the most terrible cystic acne. I mean, it was really, really awful. It was very, very difficult to live with, and it really affected my life on every level. And so I guess from then on, I was on a mission, I was on a mission on a personal level for a long time to try and fix my skin. And I think that anyone who's had skin issues will understand that if you've got skin issues that affect your daily life, it becomes a bit of an obsession. You start to look at other people who've got perfect skin and you wonder what they do to get that. And you think about your skin when you wake up in the morning, and you think about your skin when you go to bed at night. But again, it was that thing. I didn't really know who to talk to. I was studying naturopathy at the time, and I tried everything that I thought, and now I know that they probably weren't the right things to do. And so I didn't end up going back on the pill, actually, because I just couldn't handle it anymore. Look, that helped somewhat. But again, I was really suppressing what I know now with the metabolic issues, that my skin was screaming at me. My skin was, so perfectly trying to tell me, there's some things that you need to pay attention to. There's some things that you need to take care of. And so again, I took the pill, and I still had that residual fear. I didn't want to be on the pill, but also I had a lot of fear about coming off it. And it took a number of years for me to feel brave enough. And the second time I came off, I feel that I did it in a much more supported way. So, this time I told all my friends, my family, my partner what I was planning on doing and what my anxieties and my fears were surrounding that. And I ended up getting a lot of support, which was really amazing. And I got the help of a naturopath, and I got the help of an amazing Chinese medicine practitioner. And I did all of that before I came off. So I was working on this, 4 months before I came off the pill. And I found that I had such an incredibly different experience that time around. So my skin still broke out somewhat when I came off that time, but because I'd been working on it with a couple of professionals and got that emotional support as well, it was such a smoother transition. So I guess I was really encouraged by that experience. And because my skin was still a little bit of an issue, I was still determined to have healthy, clear skin. I really wanted to have that skin that I'd had in my teen years and even my early 20s. And so I was coming to the end of my naturopathy, and I was sort of in student clinic, and I was attracting a lot of skin cases, and I was getting increasingly frustrated because I was starting to notice that there was a lot of advice in the naturopathic community and at college about what to do internally, but really no one could tell me what to do externally. What should I be using topically? And so I decided, whilst I was finishing my naturopathy degree, that I was also going to do a diploma of natural beauty therapy. I actually found the most amazing course, the most amazing teacher, with a teacher that had also studied naturopathy, and her name was Bev Greenwood. She's still teaching now. And she was just the most incredible and inspirational teacher to me, like a teacher that everyone who's on a quest for knowledge really deserves. And so while I got to do my diploma of natural beauty therapy, I also was around this incredibly supportive and encouraging person that really believed in me. And so it was actually that experience that encouraged me to specialise in skin when I graduated. And so as soon as I graduated from my degree and my diploma, I opened up my small little clinic, kind of on a wing and a prayer, because I really wanted to help other people like me.
Yeah.
It was around that time as well that I discovered active skincare, and at that time it was cosmeceuticals, and that really helped my skin a great deal as well. But I suppose with regards to my primal shift, I was still really clueless at that point as to what my triggers were and what the causes were, what had led me to get into such a metabolic state that I was. And I was still trying this and that. You know, one week I'd be a raw vegan, next week I was doing Atkins. And I was lucky enough when I graduated as well to get a part-time role for an amazing nutrition company called Research Nutrition. They're based in Queensland, and I was their Victorian rep. And so I was exposed to a lot of amazing and really cutting-edge nutritional education. One of the brands that we represented was Nordic Naturals, and so a lot of education around inflammation and the omega-3/6 balance and how to test for that. And that really changed everything for me. I mean, that was really a light bulb moment. That changed my life and how I look at, you know, inflammation and disease process and how that affects the skin. It was during that time as well that I was really fortunate to meet Warren McGann and Claire Yates, who both worked at Research Nutrition. And Claire was actually completing her book, Optimum Health, the Paleo Way, at the time. And Claire's an amazing person, and she's so open and she's so generous with her knowledge. And really through Warren and Claire, I was opened up to the paleo world. You know, that was really the start for me. During that time as well, I got quite into functional pathology testing in a big way, because that's part of what Research Nutrition does. And I was still, even on a paleo protocol, having some issues with gut function, bloating. So I did some stool analysis on myself and got to the heart of some of those issues. Had to do a low-carb paleo for a while at the end of last year, and I hope never to do that again.
Yeah, it can be a little bit rough for some people.
Yeah, absolutely. But look, it's a great experience to have in clinic as well, and teaching a lot of my clients about, you know, what works for them.
Yeah.
So look, that's in a roundabout way how I came to where I am now, with a lot of help and a lot of mentors and a lot of determination. Yeah, I still consider myself a reformed acne sufferer. Like it's still, you know, if I'm out of balance, it's still going to come up, but I don't have those fears and anxieties in my life anymore.
That's great. And so, Asha, just for the benefit of our listeners, where are you based?
I'm currently based in Melbourne, so my clinical practice is in Collins Street, Melbourne. We just moved here 2 weeks ago. It's a beautiful area. We're very much enjoying it.
Yeah, fantastic. I'm sure you'll maybe after this episode get a few new clients.
So, Asha, you mentioned metabolic difficulties, gut health, and inflammation. What do you see as the main causes for people who are suffering with acne? What are the main things that could be going on for them?
All right, so there's no doubt that especially adult acne is a complex set of issues, and I think that's why traditionally it's been so challenging to treat. Also, you know, there are a few main factors that we can look at, but I would just like to say that by the time someone's got adult acne, and particularly when I see them in clinic, you know, this thing's been compounded for 5 or 10 years perhaps, because they've done what I did. They didn't feel that they had any other options. And so just about everybody that I see has tinkered and dabbled with medications before they come in to see me. And so, you know, that's fine, and you do the best you can at the time, but this tends to compound issues by the time we get around to unpacking them. So when I'm taking a case history, probably the number one thing I notice with almost 100% of my clients, if it's adult acne, then it's usually most always triggered by a period of stress. So an intense period of stress seems to kick everything off. It's almost like a big set of fireworks, and the stress is the match. you know, and it just kicks everything off in quite a profound way. The other thing that I see is, you know, people who potentially had a functional hormonal imbalance as a teenager. So very, very common when I'm taking case history for people to say, look, I started breaking out as soon as I got my period when I was a teenager, obviously for women, and then going on birth control for 10 years, and then they're dealing with it as an adult. So I do classify that as adult acne, but that's a little bit different. And by that time, there's usually some stress factors as well. So I guess what I'm saying is it's not straightforward. There's always an underlying inflammation issue, and there's always an underlying metabolic issue. With regards to the inflammation, I guess that's why the paleo protocol works so well, because it is the most anti-inflammatory protocol around. I mean, we know that. It's demonstrated. I've seen it in blood, you know. So I would say that cortisol is really the instigator, because people talk so much about hormonal acne, and of course hormones play a part, but I would really, from my clinical experience, without hesitation, say that from my perspective, it's more of a metabolic issue that affects hormones. So what I mean by that is that cortisol will affect insulin, making people somewhat insulin resistant. That will affect their androgen hormones. So testing hormones without looking at cortisol is not ideal. We really need to be looking at the whole picture.
Okay. And Asha, I've read a lot, and a lot of people talk about dairy as being a bit of a culprit with acne. What are your thoughts on dairy?
Yeah, that's an amazing question. And look, I was really a little bit on the fence with that for a while. I mean, we're never going to advocate someone drinks cow's milk, but it's, you know, I've always sort of said to people, it's an individual thing. Let's see what you tolerate in terms of goat's products and that kind of thing. And butter's a different, you know, category altogether. But look, I have been recently doing quite a bit more reading and research into something that is quite profound. And let me explain that and how it relates to dairy. So we've been looking at something called mTOR, which stands for mechanistic target of rapamycin. And basically, mTOR, everybody has it. We've all got it. It's actually a sensor for certain types of food energy within the body. And high GI foods that trigger insulin and insulin-like growth factor, and dairy is a food that triggers insulin-like growth factor, actually increase the production of the enzyme mTOR. So mTOR actually, when it's in overproduction, so triggered by high GI foods and dairy, will lead us into a metabolic state and actually have a direct effect on the skin by increasing sebum and hyperkeratinization, which is the way that the keratinocytes are shedding in the skin, which is a big part of the pathophysiology of acne, and will create inflammation. So really it has a direct effect on breakouts. And an overactive mTOR pathway is also associated with other metabolic diseases like PCOS and diabetes. And so for that respect, dairy is absolutely a no-no when someone's actively breaking out, from my perspective.
Okay.
And when you talk about metabolic pathways and things like that, is it mainly the cortisol and insulin you're talking about in terms of hormonal causes for acne, or are you also alluding to other metabolic hormones as well?
Look, there's no doubt that cortisol is a really big instigator, and cortisol is actually part of the hormone cascade. So it's very, very influential. And if you've got an overproduction of cortisol, you know, then DHA, which is the mother hormone, is being used as a building block for cortisol instead of a building block for hormones. There's no doubt that there's lots of women with hormonal issues out there, and sometimes it's a little bit hard to determine how much that would be affecting them if cortisol wasn't a factor as well. Because there really aren't many cases that I see where cortisol isn't a factor or adrenal fatigue isn't a factor. Now, I get a lot of women come in and say that they have been diagnosed with polycystic ovarian syndrome. And from what I've learned with the pathology, because I don't treat hormones without seeing hormones, I don't have a hormone protocol, I treat the individual, is that you can have 5 women who've been diagnosed with PCOS, and they can all have completely different hormone presentation, like completely different. So when it comes to that, it's all about the testing, and we have to be looking at the whole picture. So as well as the cortisol, we need to be looking at the whole hormone cascade, preferably through salivary or urinary hormones.
Okay.
So it's salivary or urinary testing.
So for those who aren't lucky enough to be coming to see you for testing, what kind of tests should people ask their GPs or their naturopaths for if they're wanting to investigate this a little further?
Look, there's lots of really valuable insights that we can get from the most basic tests. So, even just starting off with a full blood exam and looking at vitamin D levels is going to be really helpful, because in a full blood exam, you'd be expecting that they'd be testing for iron. Now, iron is quite involved in hormone production as well. B12, that's really essential too. Vitamin D, we're always wanting to have adequate vitamin D levels to make hormones. But really, if someone's been going through this for a couple of years, we don't want to mess around. We want to get to the heart of the issue. So, look, I've always found urinary hormone profile exceptionally good for looking at all of the upstream, downstream metabolites, as well as it tests the cortisol as well. So it's a US biotech test. Salivary hormones can be a cheaper way of getting a snapshot. But as long as they're looking at the cortisol as well as the major hormones, so we're looking at 3 types of estrogen, progesterone, testosterone, but also what's often not included is the DHT, which is substrate of testosterone, which is really crucial to look at too. And of course, it's all part of the case taking. Not every case of acne is hormonal. Yes, there's always a hormonal element, particularly for women, but there's also a percentage of people that I see that have a lot of gut issues, and we can really tell, as well as the case history, it depends where that person's breaking out on their face as well. So, typically jawline, chin, neck, then we're thinking, yep, that's hormonal stress. It's really a HPA axis issue, so the hypopituitary adrenal axis. So there's usually hormones, stress, maybe a bit of thyroid and liver. Someone's breaking out all over. Like a lot of people that I hear from, they're doing all the right things. They're following a paleo protocol. They're drinking lots of water. They've taken themselves down from high intensity exercise. They're doing mindfulness practice, and they're still breaking out on the forehead. And that's when I start to dig a bit deeper with regards to gut, because I have seen cases where they're breaking out all over, yet they're doing all the right dietary stuff, and it's parasitic. So I'm seeing a lot of parasitic cases, as well as all the other, dysbiosis and candida and all of that. But what I have noticed really is that if they're breaking out all over the face, despite all of their best dietary efforts, and perhaps they've got a history of traveling overseas and getting unwell, food poisoning, or taking a lot of antibiotics, then we really need to look at doing a 3-day stool analysis.
Yeah. Asha, I've also known in the past men who have been inflicted with acne across their back, particularly around the shoulders, quite bad. It seems to be quite unique to males. Is that related to testosterone in any way, or what would cause that?
Look, I have seen some male clients, but typically predominantly female, and female clients that can also get breakouts on the back, and they can be quite painful and deep and cause scarring. And yes, from my experience and my understanding, that's more of a testosterone DHT issue. Absolutely. Yeah.
So what are the most common mistakes you see people making when they're trying to solve the problem themselves that might be, creating their adult acne in the first place or making it worse?
Yeah, sure. And I would really like to emphasise that, we do the best that we can at the time with what we've got, and it's okay to forgive ourselves for mistakes that we've made, and that really experience is the most powerful educator, and sometimes we have to make those mistakes to learn what doesn't work for us as well as what does. But look, I'll give you my top 5 mistakes. So number 1 would be using products or treatments that are too harsh. So, going to the pharmacy and getting your products that have got benzoyl peroxide in.
Tried those.
Yeah, we've all tried them.
Yeah.
It's a bleach.
Yeah.
We don't want to use bleach on our face, particularly because most people are presenting with a dry acne. They're presenting with something called acne tartar, which is not an oily acne. And so, the function of benzoyl peroxide is to really, it's a degreasing agent. It's to cut through the oil. And so if someone's presenting with a dry acne that's already deficient, the skin's showing deficiencies of lipids and water, then it's going to create a lot of damage to the barrier function. And that goes also for things like topical retin A. People are really quite quick to use that. And any kind of products that have got fragrances, emulsifiers, you guys know this, that are not pH balanced can cause quite a lot of damage. But also having those in clinic treatments like clinical skin peels and things like that, because if it's a dry acne, I used to do clinical skin peels in my clinic, okay? So I feel confident to talk about this. I used to do microdermabrasion. I used to do clinical skin peels. And the reason I don't do them anymore is because they weren't working, okay? So in the short term, people were saying, oh, yeah, my skin feels great. It feels clean. It feels smooth. But in the weeks following, the skin was just returning because we hadn't corrected the nutritional deficiencies that were displaying in that skin. We weren't feeding the skin. We weren't restoring the barrier function and preserving the structural integrity of the stratum corneum. So that's number one. Number two would be getting on medication too early, potentially. I say that based on my own experience of being on birth control as a Band-Aid from the age of 18 to 31. So I feel like I can speak from experience with that, because the earlier you get onto this, the faster and easier it is to resolve. The longer it goes as a latent metabolic issue that's covered with a Band-Aid, the more challenging it is to unpack, because then you're dealing with the nutritional deficiencies associated with some of those medications. And, with Roaccutane, for example, we're all quite familiar with the fact that it's a strong drug, but, it can cause DNA damage, liver damage, imbalance in vitamin D, those things. There are a lot of things we can do to get to that point. I'm not saying that it's not right for some people. Some people I know have had good experiences with those things, but there are a lot of things to try first. The third common mistake that I have experienced, and I see quite a lot of, is people sort of trying to solve it themselves, doing it alone, and not talking about it, not getting the help and support that they deserve for it. So letting that skin issue dictate the support and the love that they're getting in their life. And I know that I did that because it can make you feel unworthy. It can make you feel embarrassed. You don't want to talk about it. And one of the biggest things that I've been on a mission to do for the last few years is to shine a light on this. Let's talk about this. Let's see it for what it is. It's really, it's like the red light coming on in your car, Having acne is like the red light coming on in your car, and you don't change the light bulb, do you? You pop the hood and you see what's going on in the motor. And so really wanting to spread the word that our body is so clever, and instead of beating ourselves up about having this, if we can really recognize it as an opportunity to tune in to what's going on in our body, get some help, and deeply honor and reconnect with ourselves, it can actually be a beautiful and empowering journey.
Absolutely. And it's much better that our skin tells us that we're inflamed by becoming, red and inflamed, rather than it going on the inside and then we, drop dead of a heart attack or a stroke or something, and we never get those warning signals.
Yeah. And there's so many, like you said, self-esteem issues attached to it, because it's so visible on our faces, when we've got acne issues, that it's very difficult to hide, and it's so visible people can't really deal with it, then it can really affect confidence, can't it?
It can. And look, and in some cases that I hear of, it's appalling what people have to go through. The comments that strangers will make, the comments that well-meaning family and friends who've never experienced acne will make. It can be quite devastating. So I'm saying, let's stop that. Let's start being, almost owning the fact that our skin's really giving us a huge motivating factor to look at what's going on.
Yep.
And I think that in the presence of hope, that's possible. A lot of people lose hope because they have bad experiences. There's a lot of people out there having bad experiences with the practitioners that they go to see and with the alternatives or drugs that they're being offered that they think is the only option. And so, you know, self-confidence and that mindset is a lot easier to have in the presence of hope.
Yeah.
So the number 4 thing that is my real bugbear, is picking. So we've all done it. And it's like a guilty pleasure, but picking the skin is really one of the worst things that you can do. It's so damaging when the skin is particularly already inflamed. It's already got issues with wound control and wound repair. And so by doing that, it's causing a lot more permanent damage that takes a lot longer to resolve. So we're talking about, post-inflammatory hyperpigmentation here, the brown or the red marks that are left behind by breakouts. So no picking.
So some of us, though, we've just got that compulsion. You walk past a mirror and you can't stop yourself from leaning in, having a little look, running your fingers across and having a little pick or a scratch. So what are some like simple little things that we could do to remind ourselves to keep the hands off the face?
All right. Well, realistically, I know that people are going to touch their faces. And look, if you've got a pimple that's it's out there, it's talking to everyone, it's like, hi, how are you? We want to take care of that. So if you do have something that's really ready to come out, then there are ways to go about it. Obviously, it's better to have it done by a trained clinician who's got all the right, hygiene procedures and is not going to do any damage to the skin. But, it is possible to use some gloves that you pick up at the pharmacy and to use like a sterilized pin and to very, 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 very gently squeeze and then to leave it there. Not to play with it anymore. And so, if people are going to touch their face, only with clean hands, only ever with clean hands. And look, it's a habit like anything else, and we can retrain ourselves to stop doing it. And it's usually a matter of deciding to do something else instead. So, I want to pick my face, play with your fingers. Get on your phone, do something else.
Yeah.
But I understand it is a big one.
Yeah. No picking.
No picking. So number 5 would be obsessing. So we tend to, I guess this is going into what we were saying about the isolation as well, but it's quite easy to become obsessed about your skin. And look, it's understandable, but it just doesn't help because it's raising all of those stress hormones that we were talking about before. I see it a lot with people who have been eating really well and we're still getting to the underlying causes through pathology. And so they'll really put a microscope on what they're eating and they'll really beat themselves up if they have a piece of chocolate or something like that. I don't ever want anybody to feel like bad about what they eat. If you're going to eat some chocolate, then really enjoy it.
Yes.
I do. Really, really enjoy it. The obsessing becomes part of that negative self-talk, and almost like an excuse to beat ourselves up. And so I want people to do the opposite. I want people to give themselves, be kinder and gentler to themselves than they usually would be rather than going the other way. If you love your skin will love you.
Yeah.
And Asha, what are some, speaking of loving your skin, some things that people can do at home that products they might have in their cupboards or in their fridge that they could put on their skin to, say, soothe an outbreak or give it a little bit of love?
Yeah, sure. That's a great question, and it's one that I get a lot of people, really wanting to use the right thing on their skin. And there's a lot of confusion out there because, we get a lot of bad press about skin products. And I've even talked about it now, beware of the dangers of the benzoyl peroxide products and all that kind of thing. I'm not an advocate for, covered skincare. I do believe that you can also do damage by using products from your cupboard or your fridge that have the potential to oxidize on the skin and cause free radical damage. I think that if it's a big enough issue for you, you'll find an expert who can help you with some tailored and prescribed skincare.
Yep.
And I certainly haven't seen, I do hear some people having success with coconut oil, but I haven't seen that myself. Yeah, it can be. I use it on my body. For the face, it can be quite occlusive. So yeah, I think that if your skin is affecting you every day, then you need some help with that. There's things like liposomal zinc that we can be using topically. There's some incredible things out there. There's just not widely known about.
Yeah.
So save the cupboard and the fridge items for your tummy. I would say.
Awesome. So in terms of what we can be doing on the inside, what are your recommendations for dealing with some of these issues? Because we've sort of unpacked all of the mistakes we can make and all the problems we can have, and certainly stress and gut issues and hormonal issues. Blood sugar regulation can be the cause for a lot of these things. So what are some of the things that we can do to really help reduce that stress on the body and the stress on our lives and help the acne?
Yeah, sure. And this is the exciting part, because now we're onto the stuff that, we know works. Okay. So this is the stuff that we know works, and it might not work straight away, and it might not work on your own. You may well still need a practitioner or a functional medicine practitioner to help you with some pathology. But what I like to do is to take away the mystery and to give people guidelines and frameworks so that they can be consistent with something. They're not jumping around from one thing to the next, and they feel good about, it's really important you feel good about what you're doing. So one of my biggies is sleep. Sleep is one of the best things that we can do for stress levels and for our adrenal glands and for our hormones and for our skin, because our skin only regenerates really when we're asleep. And our skin really only gets the building blocks it needs to regenerate and repair once the rest of the body is satisfied. So there's a hierarchy in the body, and skin is the last thing on the pecking order. So we really need an overflow to be able to reach the skin. So sleep, like I'm talking 8 to 10 hours a night, and naps in between as well, particularly if there's been a period of stress. And this can make a profound difference. And these kind of things are the foundational things. If we're not getting enough sleep, then any supplement, you can't buy sleep. Okay? You can't, there's no supplement in the world that's going to compensate for lack of sleep. So sleep is free. It's fun. Let's all start having lots and lots of sleep and feeling really good about that. So there are issues when people are having problems sleeping, and there's a lot we can do to help with that. But getting into bed before 10 and getting as much sleep is great. The next thing is eating frequently to balance out those blood sugar levels. So eating every 2 or 3 hours and eating enough. I mean, there's a lot of people out there who aren't eating enough. And that's stressing out our adrenal glands, and that's increasing our cortisol. So if you need help with that, see a practitioner. They'll be able to help you go through that. And eating the right kinds of things. So like I said before, the skin is the last organ of the body to be receiving nutrition. And so we actually need an overflow. We really need to have an overflow so that it is able to feed the skin. Because if you've got issues going on with your gut or with your liver, then it's going to actually chew up all the nutrition before it gets the chance to get to the skin. So I'm talking about eating, between 6 and 9 cups of vegetables a day. Eating good quality protein with every meal. Bone broths, fermented foods. Bone broth is actually, one of the best things for skin. I mean, talk about collagen, anti-aging. It's an anti-inflammatory. It's just, it's got everything the skin needs. I mean, it's got all that beautiful iron and zinc and glycine. So, start having lots and lots of bone broth, but having a very wide variety. When I say to people 6 to 9 cups of veggies a day, I say to them, I don't care how you get it in. I don't care if it's raw or cooked or steamed or roasted or juiced, just get it in. Yeah, let's not get hung up on the detail. Let's just get in the business of consuming lots of good quality foods.
And Asha, are we talking about leafy greens? Are we talking about starchy veggies, colourful veggies? veggies that contain a lot of sulfur, or all of the above?
All of the above, definitely. But if you want a rule of thumb when it comes to the skin, I would say say we're looking at 6 cups a day, half of those to be green leafy veggies and herbs. Mm-hmm. So a lot of green leafy veggies. Getting into the habit of throwing those into absolutely everything that we make, because green leafies are the most alkalizing food that we can have. Acne is an inflammatory condition, so we really need to alkalize the system, and so many beautiful minerals and folate, that's necessary. The B group vitamins are essential for the skin. With starches, women, please keep up your starches. So having 2 to 3 serves, we need them for hormones and for adrenal health. So 2 to 3 serves of, pumpkin and sweet potato, things like that, depending on how stressed you are as well. And then not too much high intensity exercise. We do want to get a sweat up for the skin, but if there's a stress component as well, then a better option definitely is the lower intensity yoga and walking. And whilst you're rebalancing your skin, sugar in any form is a no-no. So are stimulants. So I'm talking about alcohol and coffee and chocolate. So people who are on that metabolic roller coaster or that metabolic freight train that the acne is displaying are also super, super sensitive to stimulants, and they need to be eliminated completely until the balance has been restored. Getting help, I've mentioned this before, but I can't emphasize it enough. Getting help soon and getting the right kind of help. So if you've been breaking out for more than 12 months, you need help to resolve it. And you need to see someone who specialises in skin and or a functional medicine practitioner who's very well-versed and competent at functional pathology testing to get to the heart of the issue quite quickly. Being consistent, so sticking to everything you're doing and having faith in that as well. And having lots of water.
Lots of water. Yep.
Lots and lots of water. So a litre of water for every 25 kilos of body weight is ideal. Let's get things moving, let's hydrate.
Wow, that's a good 3 litres for me.
Yeah.
I don't reckon I'd be getting that in.
Yeah, we're all dehydrated.
There you go.
Yeah, I can feel it. As soon as I start to tip a bit with my water intake, I feel so much better after having a bit of a drink. Even if it's herbal tea or something, it's just getting the liquid in, isn't it?
Absolutely. Look, there are enzymes in the skin that, there are enzymes in the whole body, but there are enzymes in the skin that can only function in the presence of free water. So you imagine that if you're not drinking enough water and therefore there's not enough to go to the skin, because as we've said, all excess goes to the skin, and there's no free water in the skin, the enzymes that work in the skin, they can't do their job. They go to sleep.
Yeah.
So we really need that free water so those enzymes can be working like little Pac-Man to clear out the follicle so that we don't break out.
So I'm getting, Asha, from everything that you've said, there seems to be a common theme around stress. Like one of the, the number one messages would be for people to think about the stress that's happening in their lives, or whether it's, internalizing things that's causing the acne potentially. And then, of course, there's all the nutritional things that people can do and the topical things. But if people don't have that stress and the sleep, as you said, sorted, then nothing else is really going to fall into place, is it?
That's exactly right. Nothing's going to stick. It's, we have to lay those foundational things first and foremost for everything to stick. One of the biggest mistakes that I made, and I made a lot of them and I'm really grateful for them when I was trying to heal my own acne myself before I knew any better, was I was constantly detoxing, I was constantly juice fasting and detoxing, and really my adrenals couldn't handle that. I really needed to be feeding and nourishing my adrenals and my hormones. And so, yeah, it's really important that we recognize that most of us are a lot more stressed than we would like to admit. And sometimes it does take something that happens with our health to bring it home. Yeah. How rampant the effects of stress, and particularly the effects on insulin, are.
So, Asha, this has been a really fascinating discussion with you. I think anyone listening who has any type of skin issue is going to get a lot of benefit from that. And we'll definitely make sure we put all the links in, things that you've mentioned. It would be great to finish off by asking you a question that maybe taps in more into you, by finding out, is there something you're doing at the moment, whether it's a practice or maybe a new food or something that you're reading or researching that's really lighting you up at the moment that you're excited about?
Yeah, sure. So, it's really important for me that I try everything. I'm big on experience. I try and be a bit intuitive about that as well. So, we're in the middle of winter here in Melbourne, and I've been very busy setting up a new clinic along with the other things that I do, being a stepmom. And so lately I've got a really beautiful habit that I've got into. I live quite close to St Kilda, so I go down to St Kilda by myself and I go for a big walk along the beach.
Nice.
And just feel that wind blowing through me, like all those negative ions coming off the water. And then on the way back, I stop in at the sea baths, and they've got a really nice saltwater spa. And they've got a steam room, a sauna that's got beautiful like eucalyptus smells. And so I've been, definitely getting into that to try and counteract my winter blues.
Yeah, nice. Well, that's another good way of getting your sweat on if you're not undertaking any really intensive exercise. Hey.
Absolutely. Yeah, absolutely.
Fantastic. All right, Asha, thank you so much for your time. Where can we find you online?
Yeah, sure. So I have a brand spanking new website that I'm very proud of. It's ashaevertz.com. So ASHAEVERTSZ. I've got some great toolkits and resources on there, and I'm just going to keep adding them. Also, I've got a Facebook page called Clear Skin Help, which I was wanting to create a clear skin community, so a place where people could learn and be part of something, so they didn't feel alone.